Welcome to the second annual Texas Biomed Global Health Symposium. My name is Dr. Akudo Anyanwu, and I'm a Vice President for Development at Texas Biomed. We are so excited to be streaming virtually to people from across the globe. We're even more excited to see all the smiling faces in the room today, and happy to host you at this beautiful venue, the San Antonio Botanical Gardens. I'm thrilled to welcome everyone to the beautiful city of San Antonio. Before we get started, I want to thank some very important guests and supporters. Without their help, this event would not have been possible. I'd like to thank our gold sponsor, the Zachary Group, thank our silver sponsor, University Health. I want to say thank you to our bronze sponsors, Corinna and JB Richter, the Southwest Research Institute, Caravaggio Pharmacy, Carla and John Brozovic, and UT Health San Antonio. I know that we could not pull off such a fantastic event without the incredible support of these sponsors, so please join me in giving them a round of applause. And now it's my distinct pleasure to invite Dr. Larry Schlesinger, President and CEO of Texas Biomed, who is an active physician scientist in the field of infectious diseases, to open our symposium. Larry? Welcome.
Thank you very much, Akudo. And I will say, good morning. Good morning. Even getting better with time, I see. I too want to welcome our speakers from around the world, our city and county officials that are joining us at this symposium, our community leaders, our distinguished guests to this very important event, critical event for San Antonio, for Texas Biomed, the entire global community. And what an extraordinary venue, the Betty Kelso Center. I think we could do rougher than to have coffee out in the garden. So I want to say a few words here to kick off the show this morning. Last year, we launched the initial symposium in the midst of the global pandemic, COVID-19. Vaccines were just beginning to be administered to adults. COVID cases were rising and falling in waves, right? We were learning about the waves. And we'd not even experienced the effects of the variants that are so prominent globally today. Scientists had just begun to study the concept of long COVID and the relationship between the infection and a variety of diseases that we know so well today. While COVID-19 has dominated the headlines these past few years, many of us continue the vital research and implementation of public health strategies to combat many other important infectious diseases that, frankly speaking, have been neglected during the COVID-19 pandemic and are expected to increase for the years to come. With this symposium, we're taking time to stop and reflect on where we've been and where we're going with respect to leadership, innovation, and community impact on public health. Now, Texas Biomedical Research Institute, I would argue, was built for this moment in history. The Institute, for those who don't know, dates back to 1941, when an oilman and rancher decided that his legacy would be to establish a city of science in the outskirts of San Antonio, Texas. Just think about that for a moment. Tom Slick Jr. was a businessman, a philanthropist, an adventurer, and a visionary. But perhaps most important to me, he implemented his vision. You know, he launched 5 research institutes in the 1940s and 50s, 3 of which are standing today. He dreamed of a place where science was performed for the benefit of all people, making lives better, safer, and healthier. We are that place, and therefore we at Texas Biomed, we feel, have a responsibility to marry the science with the public health efforts of people locally, regionally, and globally. Texas Biomed's mission is to protect you, your families, and the global community from the threat of infectious diseases. The dedication and passion of our scientists and the biomedical researchers around the world is driven in part by the opportunity to offer better health outcomes worldwide. We've all learned that infectious diseases impact more than our personal wellness, much more. They impact our economies, our culture, our infrastructure, frankly, our whole way of life. We need leaders in every industry to stand up for science and to keep engaging the public in dialogue, even when it may be difficult. We need innovators to solve complex problems of science, and we need innovators in public global health. And we need our community to come together with empathetic ears to listen to one another and engage in healthy debate and discussion. This is the major goal of this symposium. I would contend that we must do better going forward, and we must do it together. We need to be proactive, much better than we've been in the past, and we need to have a sustainable infrastructure going forward. Let's finally learn from history. I'm so pleased to spend the next 2 days with you as we envision new and forward-thinking approaches for leadership and innovation that impact our communities. The people we've invited often say to us, "Why have I been invited?" And then when it's over, they say, "I'm so pleased that I've been invited." That is the goal. Thank you for being here, both virtually and in person. Your presence shows your strong commitment to making a positive difference in our community and the world. And now, with that short introduction, it is indeed my distinct honor and privilege to introduce our kickoff keynote speaker for the Global Health Symposium 2022, Dr. Judith Monroe, President and CEO of the CDC Foundation. And let me say a couple of words about Judy before she comes up. Dr. Monroe has dedicated her career to protecting people and saving lives. She joined the CDC Foundation in February of 2016 as President and CEO, following her role as Deputy Director of the U.S. CDC and the Director of CDC's Office of State, Tribal, Local, and Territorial Support. In her work at the CDC Foundation, Dr. Monroe advances priority programs that improve health for people across America and around the world. The CDC Foundation mobilizes philanthropic and private sector resources to support CDC's critical health protection network, managing hundreds of programs in the U.S. and in more than 140 countries. Today, she'll share with us more about the work of the CDC Foundation and focusing on partnerships and philanthropy in pandemics and beyond. She told me this is her very first trip to San Antonio. Let's all welcome Dr. Monroe to the stage.
Well, good morning. And thank you so much for that kind introduction and for the warm welcome to San Antonio. It is such a pleasure to be here. I am really honored to have been asked to speak, and I was one of those. Why am I being asked? And now I'm so glad I'm here. So I have to tell you, this is a remarkable event, the Global Health Symposium. And I want to do a shout out and thank the Texas Biomedical Research Institute for the remarkable work through the pandemic and all of the other work that you all have done. It's just such a great impact here across the United States and around the world. So I really love this year's focus on the symposium: leadership, innovation, and community. Really well stated. There's nothing, the COVID-19 pandemic is such a stark reminder to all of us of the wicked problems that we face as a global community. And how these problems we face are complex and they're interconnected with all these other problems. And the solutions aren't ready-made. They're not off the shelf. This isn't something, I think this virus has taught us that, right? Dr. Rochelle Walensky, the CDC director, many times has said, wow, I keep getting curveballs, right? The virus keeps giving us the curveballs. So these are wicked problems that we need to solve. But we also need systems thinking. So with the theme of this year's symposium, I recall a conversation. So this was late January of 2020, and I recall a conversation I had with a colleague at the Gates Foundation. And I said, the CDC Foundation, we activated a couple of days ago our emergency operations fund to help with the response. Now this was in January. And he said, wow, I'm so glad you're leaning in fast and hard. He said, this is going to be big. It's going to mean an all hands on deck response. However, the CDC Foundation, we're not an endowed foundation. We were created by Congress to help CDC. We have a broad mission to help public health, but we go out and we rally and mobilize resources. So we activated our emergency fund, which means that we get out there and start calling on folks. I spent the month of February of 2020 on webinars. I was calling donors, and quite frankly, very few responded. Very few donations came in. They had a lot of questions, and I found myself getting frustrated. And on the webinars, I'd say, don't hesitate. You don't understand, this virus is spreading quickly. This is going to be big. Did they not understand it was going to be big? And it wasn't until March, when the world shut down, if you recall that, that's when the flow of funds came. So I want to take a moment and celebrate and thank philanthropy and public-private partnerships across the world. Philanthropy really answered the call. They came in. It's reported that in 2020, globally, over $20 billion was put forward to help with the response from grant makers and wealthy donors, and that should be celebrated and commended. But I'm here to tell you that there's room for improvement. And one idea is to pre-position emergency funds with trusted nonprofits in non-emergent times. So I'm going to give you an example of this. The Robert Wood Johnson Foundation, who's a close, we're strong partners. A few years ago, they decided to donate to the CDC Foundation's Emergency Response Fund in the peace times. And then when an emergency occurs, we will call the leaders at RWJF and say, is this a response? We're activating. Would you like to respond? Would you like to contribute? So on Sunday afternoon, January 26, 2020, I had a phone call with Dr. Ann Schuckett, who was the principal deputy director at CDC at the time, and we discussed the fact that CDC had just activated their Emergency Operations Center, and I asked, we're going to activate, how much should we raise? What kind of goals should we set? How would this compare to Ebola? And her answer was, this is starting in China. It's a large population. This is a coronavirus. It's going to be big. I mean, her prediction was it's going to be big. And so my next outreach was an email to leadership at RWJF. And I said, we're activating. We're going out tomorrow with a press release. Would you like to mobilize funds? The press release the next day announced that we were activating, and the first $1 million had come into the Emergency Operations Fund from RWJF. That, my friends, is the speed of trust. That is philanthropy really pre-positioning and getting ready for the next event when we think about the emergencies. And so with trust comes speed, and philanthropy, in my opinion, is at its best when it trusts those with the knowledge and the operational capacity to move quickly during a crisis. CDC Foundation has traditionally received funding that has been restricted to specific programmatic work. So we found ourselves during the pandemic, being both a grantee and a grantor, thanks to the fact that we had learned our lessons and we applied them when this hit. I remember sitting with my executive team saying, this is our moment. Just, Larry, as you had said, this is what you were built for. CDC Foundation, we were built for this moment. We need to respond. We need to step up to the plate. So we leaned in hard and fast, and we really opened the floodgates for our fundraising in ways that we had never done. So talk about innovation, we were innovating. And trust me, I pushed some of my staff way beyond comfort zones. So we included crowdfunding. We had never done that. Crowdfunding, employee giving, cause marketing, virtual events like the NFL Draftathon contributed to the CDC Foundation. Some great folks from Saturday Night Live decided to do a Saturday Night Seder virtual event, contributions to the CDC Foundation. But my favorite and most heartwarming was when I learned that children were beginning to sell their artwork, or they were doing virtual musical events, and they said, donate to the CDC Foundation. Now, children prior to the pandemic had no idea we existed, but they learned with all the media attention, right? And then children started posting on Facebook, my birthday is next Saturday. Please honor my birthday, or don't give me a gift, give a donation to the CDC Foundation. That's pretty heartwarming. And so we had a moment in time where there was a shared sense of mission and partnership all the way from our children up to our top scientists across the world. Really an incredible moment. We cannot lose that. We cannot lose it. We don't know when the next pandemic will come. So as unrestricted funds started coming to the CDC Foundation into our emergency response, we started to make grants because we were meeting the needs. Everything that CDC asked us to fund, we had enough funds to do that, and we had surplus. So our goal as a new grantor was to assure that the funding coming in at any moment in time, we wanted no less than 90% of the funds coming into us to either be obligated or spent. So we were moving quickly. We actually achieved closer to a 95% during the height of the pandemic. Now, remember, we'd all gone home to work. I'm an extrovert, so I wasn't with my team, so I have to work alone. So I turned my house into a war room, much to the chagrin of my husband. He finally made me take the big poster boards and the papers off the windows when spring started to come, because I really want to see the light. But I'm a visual. I needed to visualize our grant making. I needed to see the system. So because of our positioning in the public health ecosystem, we wanted to contribute across the United States and globally. So geographical distribution was very important for us to pay attention to. We also wanted to think systems. We wanted to help support the systems that were needed. That started with research. This was a novel coronavirus. There was so much we needed to learn. But then it also was on the ground, the personal protective equipment, the quarantine needs of those, technology and digital tools. We leaned into that quite heavily early in. And then communications. We needed a little help there across our country. We formed with partners a Public Health Communications Collaborative. We formed with partners a Health Action Alliance, bringing businesses together. And we, in turn, supported the businesses with knowledge, with the real-time knowledge of what was happening with the pandemic. And then as vaccines, and thank you for the vaccines. I mean, thank you for everyone that's contributed to the research and development of this remarkable innovation and such powerful public health tool. Vaccines are only as effective as the number of people that get shots in their arms. And so we had to have the trust of the vaccines system. We had to look at everything. So we ended up funding nearly 300 community-based organizations for those trusted voices who could help overcome the vaccine, or build vaccine confidence, and to make sure there was access to vaccines. Equity was at the center of all our decision making. And we worked, like as an example, one project we funded Georgia Tech University to help us with technology for people with disabilities. We worked in Black communities, indigenous, people of color, all over water systems in Alaska, the tribal needs. It just was very expansive. We also, and you may have picked up on this, we established an expedited approval system. So I got my attorney, I got all my team, we figured out how we might do this because we wanted to move quick, that we got to move faster than the virus, and that was really hard to do, right? So we funded things like research. And as example, University of California, San Francisco wanted to set up a national registry. What do we know about this novel virus in pregnant women and infants? So we were a funder, but every funding we gave, we also said, leverage the fact you got the CDC Foundation as a funder and bring in more funding. And boy, did our partners take that to the bank. They multiplied many times over what we were able to contribute. We also funded a multi-center study early, very early on. CDC was so anxious to get this started because we needed to understand the clinical implications and the clinical practice and delivery of care to folks with this novel virus, so the clinical management. A grounded story I'd like to share, going back, so you've got the research, you've got clinical care, everything in between. I get a call one day from a colleague from CDC. They're in Richmond, Virginia. This was prior to any vaccine being available. And the Latino population there had a disproportionate amount of coronavirus. I mean, there was a huge percentage of this community that were infected, and they were really sick. Gig economy, they were Uber drivers or working in the the hospitality industry, and they couldn't go to work. They were sick, and so we had an entire community on the verge of homelessness. That was the message I got. So I said, okay, I'm happy to join a call. I ended up joining a call. We had the mayor's office on the call. We had community-based organizations. We had the state health department, the local health department, had all these folks. A lot of those folks I knew. One of the key messages is build the relationships, know people before you need to move at the speed of trust. We get on this phone call. I heard the issue. Within hours, we made the donation. We said we're going to not only give funding, we're going to give technical assistance. We'll help you rally other funds. They multiplied the amount of funding we gave them. Everyone stayed in their homes. It's a fantastic story that Richmond, Virginia tells today. So going forward, philanthropy should apply the lessons we've learned in the pandemic. We have had some of our finest moments during this pandemic. Let's not lose that. Let's figure out how to continue and have sustainable systems in place. It's important that the sector maintains this flexibility that was adopted during the pandemic, funds capacity building, and includes the most at-risk groups in the discussions and in the studies. The World Health Organization has declared climate change as the greatest threat to human health. It's impacting all of us, and of course, many communities much harder. Climate change is certainly a complex problem, but climate change is driving new infections, along with so many other adverse health effects. So for climate action to be effective, it's vital to foster collaboration, not only within the philanthropic sector, but well beyond. We really need corporations, governments. We've got to reach the scale needed to tackle this global threat to all of us, to our world at large. I just heard over 50% of insects are being wiped out in certain communities, and it's just the food sources, it's just unbelievable. So philanthropy and public-private partnerships are needed more than ever, and they need to be at their best. Cooperation, collaboration, trusted relationships, it's just essential for us to do. And the last thing I'd say is that philanthropy particularly can be a neutral convener. And that's we've got to have the conversations. You all are convening today, but we can convene as nonprofits, and at the end of the day, we need to bring the whole of society together. This is about children having birthdays, and it's about grandparents having birthdays. Together, our impact is greater. Thank you.